morning.
Are you Miss Scarlett?
Yes.
Okay. I see from your chart that you've been experiencing shortness of breath and persistent cough. How long has this been going on?
It's been going on for over a year, and I feel out of breath when I'm doing simple tasks, and I even have this nagging cough with mucus.
Have you noticed any wheezing or chest tightness whatsoever?
Yes, especially when I'm walking or climbing the stairs. I just thought it was a part of aging.
Chronic obstructive pulmonary disease, or COPD, is a chronic inflammatory lung disease that obstructs airflow from the lungs. It is often referred to by other names, including chronic obstructive lung disease, chronic airway obstruction, and it encompasses two primary conditions: chronic bronchitis and emphysema.
Okay, based on your symptoms, we'll run a few tests to check your lung function. So before that, I'll have to check your breathing. Do you mind if you could stand up? Perfect. Alright. Okay, we'll also do another test. It's a spirometry test. It's a simple test where you have to blow into a tube and measure how well your lungs are working. Okay. Yeah, right. There's a tube over there. Do you mind just blowing it? You can hold it close to your mouth. Perfect. Thank you. All good? Okay. You just have to see the data right over here. Based on the collected data, your result shows that you have a reduced airflow, which suggests that you may have a chronic obstructive pulmonary disease, or also known as COPD. And this is a long-term condition that affects your lungs and makes it harder to breathe.
COPD, what causes it?
The most common cause of COPD is a long-term exposure to lung irritants, and such as your cigarettes, air pollution, your workplace dust, chemicals. In COPD, the airways become inflamed and narrowed, where your lungs produce excess mucus, and this leads to difficulties when it comes to breathing.
Is it curable?
Unfortunately, COPD is a progressive disease, meaning it can get worse over time. However, we can slow the progression through having healthy lifestyles such as exercising, medication, so it'll make you feel a bit better with your symptoms. Exercise is a really great way to reduce the progression of COPD. So I'm gonna have to recommend you to one of our exercise physiologists so she can help you help with your COPD and make better lifestyle changes. The common concern is that exercise is actually one of the best ways to manage COPD, as it strengthens your respiratory muscle and it improves your oxygen circulation and increases your endurance, so you won't feel as breathless. So yeah.
What are the systems affected and what are the determinants? The affected systems includes 1. The respiratory system, which causes permanent damages to the lung, narrows the airway, and affects the structural and functional domains in the lung. 2. The cardiovascular system. COPD increases the risk of cardiovascular diseases and causes abnormal activity in the pulmonary and systematic circulations of the body, as well as persistent systematic inflammations, which may include 2 abnormalities. 3. The musculoskeletal system, as it causes skeletal muscle dysfunction, changes in fiber type and composition and atrophy, functional changes such as strength, endurance, and enzyme activity. Skeletal muscles are sometimes underused, but the diaphragm is still working against its increased load. And lastly, the nervous system. Energy metabolism of the brain is altered, and it increases the risk of depression.
Breathing-related issues. Persistent cough, often mistaken as a smoker's cough. Asthma-like symptoms, breathing difficulties during physical exercise, fever leading to a decreased physical activity, fatigue, and shortness of breath. Functional abnormalities and weight loss, altered caloric intake, metabolic changes, increased basal metabolic rate often results in weight loss due to increased work of breathing, drugs that are used to treat COPD, and systemic inflammation. Additionally, unexplained weight loss occurs in about 50% of patients with severe COPD. Limited exercise capacity and muscle function. Osteoporosis, where cytokines can alter bone metabolism. It affects daily life, where patients with severe COPD are no longer able to have a normal life and need support and nursing care. However, affection daily depends on the stage of the disease.
COPD is a progressive disease, meaning it worsens over time. The progression varies among individuals, influenced by factors such as smoking history, environmental exposures, and genetics. In the early stages, individuals may experience mild symptoms like a chronic cough and occasional shortness of breath. As the disease progresses, symptoms become more severe, leading to significant limitations in daily activities. In advanced stages, patients may experience severe breathlessness, frequent exacerbations, and a reduced quality of life.
Hello there, Mrs. Scarlett.
Hi, good afternoon.
Good afternoon. I'm your exercise physiologist as recommended by Dr. Sarah. I see from your results the diagnosis was COPD.
Yeah.
So as Dr. Sarah has recommended, we recommend you to start exercising and implementing exercise in your daily life. Did you have any concern about that?
I do have a few concerns. It's just because I do run out of breath really easily, and I feel like the exercise is just going to make it worse.
Which makes sense. Actually, exercise is the most beneficial way to cope with COPD. It has multiple benefits. Think of as your lungs as your muscles. If you don't use them, they're going to lose their function. So it's very important to exercise your lungs, and that can happen through exercise. For your exercises, we recommend you at the Pulmonary Rehab Center. We have 3 exercises that suit your situation the best, which include the breathing exercises. They're fairly low intensity, so you're not going to feel as breathless as much, and they're going to help you with the shortness of your breath that you're feeling. And the second one is the low impact aerobic exercises. These include walking, cycling, swimming, and these are going to strengthen your heart and your cardiovascular system. And lastly is the strength training. This is going to happen at the end of the road, hopefully, once you've built up your intensity levels, and this is going to improve your muscle function. But overall, safety is key, so we definitely recommend you to avoid strenuous exercises that's going to build up your temperature. I don't want you to feel fatigued or you're going to lose balance or anything like that, so safety is always key. The mechanisms through which exercise exerts its beneficial effects on COPD include 1. Improved muscle function. Exercise training leads to increased oxidative enzymes activity in the muscles, enhancing their ability to utilize oxygen and produce energy efficiently. This reduces their reliance on anaerobic metabolism, which produces lactate and hydrogen ions, which contribute to muscle fatigue. 2. Enhance cardiovascular function. Regular exercise improves cardiovascular fitness, increasing the efficiency of the heart and circulatory system. This results in better oxygen delivery to the muscles and other tissues in the body. 3. Desensitization to dyspnea. Exercise training helps individuals become accustomed to the sensation of breathlessness, reducing the fear and anxiety associated with it. This desensitization allows them to engage in physical activities with greater confidence. 3. Reduce systemic inflammation. Exercise has anti-inflammatory effects which help reduce the chronic inflammation associated with COPD, and this can lead to improved lung function and overall health. What type of existing evidence supports the role of exercise in COPD? There is substantial evidence supporting the benefits of exercise and the management of COPD. Numerous studies have demonstrated that pulmonary rehabilitation, including exercise training, lead to significant improvements in exercise capacity, muscle strength, and quality of life in COPD patients. For example, a study done by Sprout in 2016 found that exercise-based pulmonary rehabilitation resulted in clinically relevant improvements in functional exercise capacity and health status in patients with COPD. Other studies have shown that exercise training can reduce the risk of exacerbation and hospitalization. A systemic review done by Oshii in 2016 concluded that resistance training improves muscle strength and may enhance the performance of daily activities for people with COPD. These findings highlight the importance of incorporating exercise into comprehensive management of COPD. Safety and side effects of exercise. While exercise is generally safe and beneficial for individuals with COPD, it's essential to consider certain precautions and potentials of side effects. Before starting an exercise program, patients should undergo a thorough evaluation to assess their cardiovascular and musculoskeletal health, as well as the severity of their COPD. This evaluation helps to identify any contradictions to exercise and tailor exercise programs to their needs and limitations. For most COPD patients, supervised exercise training in pulmonary rehabilitation programs is recommended, especially during the initial stages. Supervision ensures that exercises are performed correctly and safely, reducing the risk of injury and adverse events. It also provides an opportunity for healthcare professionals to monitor the patient's responses to exercise and make necessary adjustments to the program. Potential side effects of the exercise in COPD patients include exacerbation of symptoms such as dyspnea and fatigue. However, these symptoms are usually temporary and diminish as the patient becomes more conditioned. In rare cases, exercise might trigger cardiovascular events, particularly in individuals with underlying heart issues. Therefore, it's crucial to monitor patients closely and provide appropriate medical support during exercise sessions.
So are there any risks associated with exercising I should be concerned about?
I understand your concerns, but for the majority of the time, it's safe to exercise. However, in most cases, patients do feel shortness of breath, but it's important to listen to your body. So if you're overly fatigued or you feel you might be nauseous or you might faint, it's better to stop right away. In your case, we're going to recommend you to a supervised exercise rehab program. You're going to be supervised, so there's not too much to worry about.
Okay, this is a lot to take in, but I really appreciate the information and I want to manage this properly.
That's the right mindset. I want to remind you that you're not alone with the right exercise, changes of lifestyle. You can stay active and improve your quality of life. So remember, we're here to help you.
Managing COPD together. Talk to your doctor, respiratory therapist, rehab programs, or local COPD peer support groups to stay informed and active.